Once somebody comes through the door here in the centre and they've gone through cancer or going through cancer, and their families, we have all holistic treatments are free to them. So we do reflexology, Indian head massage, Reiki, deep tissue massage, lymphatic drainage. The list is quite endless, to be honest. And also we offer free counselling or psychotherapy. The centre was founded by Anne Spillane, who was actually going through cancer herself in 2011. She was diagnosed with inoperable cervical cancer, and she wanted to find a place where she would call a haven and people would support each other. So when she originally started it, it was a club. It was called the Girls Club, and it was women supporting women who were going on the journey with cancer. So they would meet up once a month in a hotel in Cork City and support each other. And then after about a year, it became so busy with people meeting up, and found the premises that we're in now. But the premises was derelict. So there was a lot of work to be done to it. She was an amazing lady who really got everybody to support her as much as they possibly could. And it's what we see today, is what has come about. But after a year or so, Anne realised people needed more than physical support and positivity. They needed holistic, and they needed counselling, and they needed therapies as much as we could give. So that's what Anne went into in 2014. And as of last year, we started realising we were seeing a lot of men, a lot of younger people as well. We changed our name to the Cork Cancer Care Centre. All our holistic therapists and counsellors and psychotherapists are fully qualified. They've been working in their trade a long time. They also give their time freely to us, which is absolutely amazing, because if you think about it, our doors would not be open only for their time that they give freely to us.
So I help Linda organise the counsellors and the holistic therapists for the Cork Cancer Care Centre. I myself volunteer here somewhere between 6 and 8 hours a week, usually full day on a Wednesday. And I work with clients who have either got diagnosed with cancer and are currently going through the journey, those who have perhaps come out the other side of it, and any of their immediate family like mum, dad, brother, sister, anybody connected directly with them. And I also provide a service, as do all the therapists here, which is an affordable service for those people in Cork who may know or realise they need help, or they need to talk to someone but can't afford the normal rates. So we do a reduced rate here, of which we give a donation to the Cork Cancer Care Centre to keep them surviving, I suppose. So overall, I think there's somewhere between 10 and 14 therapists in total, a mixture of psychotherapists and counsellors, as well as holistic therapists which provide Reiki, meditation, reflexology, massage therapy, Indian head massage. Again, holistic treatments that would go side and side with people who would be seeking counselling or psychotherapy advice. Sort of like one helps the mind and the other helps the body as such.
At the centre, I offer holistic massage. It's full body or parts of the body. It's reflexology, Indian head massage, and reconnective healing. I'm one of several therapists here at the centre, and I volunteer one day per week. The people I work with are either patients with diagnosis, the cancer diagnosis, or their families, friends, and they benefit from these therapies.
Our normal case situation is they've got a diagnosis in the hospital. They're quite panicked. It's a huge shock to them, to their system, and they look for help, which is great. They look for help straight away. Our local hospitals, they're nearest here, the Mercy and the rest, they have our leaflets, and they would hand the leaflets to us. Either they would ring or a family member would ring, and they would ask, how can you help me? Their next port of call is they would come and see me. I would sit and talk with them and see what way we can help. We always offer holistic treatments first to people, to calm, to get rid of the anxiety as much as we can, And then after a few sessions, we bring in our counselling or the psychotherapy. This is where we decide, we pair the person with the counsellor or psychotherapist we think is best suited. And once the psychotherapist or counsellor is dealing with him, they pair him with a holistic treatment. So they would normally go in for counselling, and straight after the counselling they would go in for a holistic treatment afterwards. Well, we keep saying to people, cancer is not just the person who's cancer, it's a web. It affects their family, it affects their friends. If you worked with somebody who's cancer, you know how much it affects you because you're doing the journey with them, but just on a different road. It's the same journey. So what we try and do is work together with the whole family as much as we can. And sometimes it can be their best friend. I came to Centre through to my best friend who was doing the journey and it supported me, because you're trying to, if we don't help their support network, we're not helping the person themselves. So we have to help their foundations. The centre is actually funded by the public. Our doors would not be open only for the public. We're not HSE funded, we're not government funded. So it's due to people who have huge hearts, and they run fundraisers, they do coffee mornings, they run the marathon for us. We do some events ourselves throughout the year to help us as well. We're actually the only week bank in Ireland. So our weeks come from companies who are very, very generous to us. Also from people who would have purchased the wig, feeling they needed the wig, and when it came time to use it, they didn't use the wig. And they donate them to us. We have 2 hairdressers who are volunteers here, who also have done the journey themselves with cancer, and they would prep the person for the wigs. We also supply the scarves and any head wear that they need on the day, and everything is free of charge. The blankets came about again, it was founded by Anne in 2014. She was in Boston and visiting friends, and she noticed somebody making a blanket. And she asked about it, and they said that they were actually making the blankets for a retirement home where people are retired. So they were sending blankets in for comfort to them. And Anne thought, oh, what a fantastic idea, because she was going through chemo and radium herself. And a side effect is you're very, very cold. So Anne said, wouldn't it be lovely if someone gave you a blanket to keep you warm? So she came back to Ireland and she spoke to her volunteers. And they said, would you be interested in making blankets? So Blankets of Hope came about. And now we deliver to all the oncology wards in Munster. And they're delivered like this, with our information leaflet in it. And we hand them out to the female, male, and now to the children's wards as well. We post them across Europe because people find our website. We post them through Facebook because people again find us. And as of there in June, we just passed the 15,000 mark in 4 years. Well, less than 4 years. It's wonderful because when we hand them, we don't physically hand them to people. We give them to the nurses, and the nurses hand them out on the first day of treatment of chemo or radium, and they hand them the blanket. And for someone to say that someone spent hours making a blanket for someone they're never going to meet, but just to tell them you're okay, you know, you're on the journey and we're here to help you as much as we can. And that was the whole idea, and it's worked fantastically for us. So, as I said earlier, we're not government funded, we're not HSE funded. We depend solely on the public to keep our doors open and help people going through the journey. If you can do a fundraiser for us, if you can do a coffee morning for us, if you want to run the marathon for us, please contact us here and we can help you and guide you along your road to help you do your fundraiser. But we would appreciate all the support we can get so that we continue to help as many people as we can. So if you or a family member has been diagnosed and you need support, which everybody does, please contact us. You can contact us on the Cork Cancer Care Centre Facebook page, or you can contact us on the Cork Cancer Care Centre website, or also you can email us on corkcancercarecentre@gmail.com. Our number here in the centre is 021 494 9090. We're here to help as much as we can.